Last week we talked about external snapping hip syndrome. This week we look at internal snapping hip syndrome. This is something that will affect obviously the inner versus the outer thigh. So structurally, we're not looking at glute max and ITB. We're looking at the psoas tendon, specifically at its articulation at the lesser trochanter, which is probably where most of the snapping occurs, although it can happen at the iliopectineal eminence as well. Or along the femoral head. But most common is going to be the lesser trochanter. This snap or pop will be very audible. You'll be able to hear it. And generally, for a while, this is very asymptomatic. However, over time, what clients need to understand is that during this presentation, it suggests two things. One, that there is a level of instability in that relationship that needs to be identified and strengthened functionally. Now, this could be accompanied by an overactive psoas. So a series of tests can be done to see if there is hypertrophy or excessive tension in psoas, because manual therapy may be called for, but ultimately increasing the stability around the joint is almost always going to be a part of this approach. And the second piece is that eventually that popping will lead to tendinopathy, specifically iliopsoas tendinopathy, which is something that you can most certainly guarantee your clients do not want to get. This is a very aggressive and cyclical inflammatory presentation that is very difficult to get a handle on if it starts to become a thing. So while they are asymptomatic, is actually the best window to approach therapeutic care.